Right across the country, we're looking at ways in which we can improve the relationship between pharmacists and doctors. Here at Collingwood, we already have that close collaboration as part of a team care model, and we've had it for a very long time. So aside from it being important to the people who receive services, it's also very important to the broader health system to look at the way this works and what many of the benefits are.
The pharmacy integrated model is essentially a process where we collaborate between the GPs, nurses, allied health services, whether they be social workers, mental health workers, basically in order to try and get the best outcome for every individual that comes through. We can look into their history, we can look at more complex issues where we can also bounce ideas off our colleagues and as I said, GPs and whatnot if we're not sure. You can look at the shared records that we have that we can interpret what the GP was intending, or if there's any query. It's just a lot easier just to communicate between the different people that are involved. And I find that really beneficial because we can resolve these issues straight away.
Well, our clients are particularly clients with a range of chronic and complex health conditions. So here at Collingwood cohealth, we have a number of people with mental health issues, a number of people with chronic diseases, diabetes and the like. So those populations and populations who might be socially marginalised, Aboriginal people, people living in public housing who are isolated on low incomes, those are the folks least likely to manage the mainstream system effectively. So in this case, this model benefits those people particularly.
We have a unique model in that we provide free on-site interpreters here, and they're easily available for consultations, and that means that they can be present during the pharmacy interaction, and that can certainly improve outcomes for clients. I think with chronic complex conditions, the risk of adverse outcomes requiring hospital attendance is a well-known phenomenon, and I think that by providing on-site liaison with pharmacy and easy access to affordable medications, we improve compliance, understanding about the medication, and reduce the risk of adverse effects, and reduce the number of people who go to hospital with easily preventable pharmaceutical complications.
Tôi đến phòng thuốc Tây Collingwood này mỗi tháng nhận thuốc một lần, nên chi chúng tôi rất là tin tưởng ở đây về sức khỏe của tôi, và tinh thần chúng tôi luôn luôn được yên tâm về sức khỏe ở đây, và là dược sĩ nên giúp đỡ chúng tôi về tự hướng dẫn cách uống thuốc, cách uống thuốc hàng ngày, những thuốc nào uống khi nào, thời gian nào đều rất là kỹ lưỡng, nên chúng tôi rất là yên tâm ở nhận thuốc ở tại phòng thuốc trung tâm này.
That I have multiple sclerosis, that I've had it for 20 years. The doctor and the pharmacy has been integral to my being able to not be in a wheelchair, but being able to come down here, do everything I need to do medically to keep me alive. My mobility is good, and it is so important that I come locally to get this medication.
So the benefit for us is that clients and practitioners together can closely monitor the impact that their medications are having on their overall care. The long-term benefit is people do better. They do better in the management of their care, and they do better in the endpoint outcome of their condition. In this model, we in fact share a clinical record, so we're able to see what each other are doing and we're able to make changes where they're required. In addition, we've got a range of other allied health practitioners that can support the use of medications appropriately because they're able to see what is being prescribed. They can equally provide feedback to the doctor or to another practitioner where there seem to be complications or problems with that medication. Now, when you consider how many people are admitted to hospital as a consequence of medication mistakes and errors, this is a really critical value that's provided on site at relatively low cost. cohealth is a not-for-profit organisation, so as a consequence we're able to allocate resources in the most efficient way possible to deliver quality care without the need to, for reference to a profit margin. This means that in many cases we've been able to save the government money over many, many years. There's strong documentation that the sorts of choices we're able to make about which medications we dispense and the way in which we dispense them has real benefits for public health dollar. So quite aside from being good for people, we're also very conscious that this is a model that has the potential to save the health system dollars at a time when we're all concerned about that.